Cynnes i chi gyd i'r ganolfan y Millennium bore yma. Da ni'n falch iawn bod chi wedi troi allan. Mae yna ragor ar y ffordd, ond da ni'n dall bod yna ddamwain wedi bod ar y ffordd ac felly wrach bod rheini wedi cael ei dal yn ôl. Very warm welcome to you. My name is Marion Hughes. I'm Deputy Chair of Age Cymru. It's my task to try and chair this session this morning. It's my pleasure to welcome panellists here. To my immediate left is Eluned Morgan, who is here representing the Labour Party as Assembly Member and also a Member of the House of Lords. To my extreme left then is Rhyn ap Iorwerth, Plaid Cymru AM from Ynys Môn. And then to my right is Councillor Elizabeth Evans, who's County Councillor from Ceredigion, who's here representing the Liberal Democrats in Wales. And on the extreme right, he's not a politician, well, he's not a party politician, is Ian Thomas, who is Chief Executive of Age Cymru. We've had apologies, first of all, from Janet Finch-Saunders, who is the Assembly Member for Aberconwy, and she had to pull out yesterday. Her father's seriously ill, and therefore hasn't travelled down from North Wales. And I'm sure that whilst we're disappointed that she's not been able to be here, sure we understand that that's absolutely the right decision in her circumstances. We've also had apologies from UKIP, who were unable to put anyone forward. But nevertheless, I'm sure we'll have an interesting morning. So a number of questions have been submitted, and of those myriad of questions put forward by all the people in Wales, a number of them have been picked out as representing key themes. And the first question this morning is going to be put forward by June Clark. June.
Hi, my name is June Clark, and my question is this. What proposals or plans do the panel have for funding long-term care of older people in Wales?
Right. Should we start on my extreme left? Yeah?
Bore da, very good morning to you all. It's a pleasure to be here, and glad that we're getting stuck in with probably one of the biggest issues that we face when it comes to health and social care in, I was going to say in Wales, but probably in any country anywhere with ageing populations and our quite right need to make it a priority to look after old people. We live in a world of budgetary constraints, but we have to make sure that we deliver what is right for our population. We spent a lot of time in the recent election talking about what our proposals would be on this front. We certainly believe that there is a principle at the heart of what we need to be considering, which is that social care should be considered in the same way as healthcare, in that it should be free at the point of need. Unfortunately, it's not a matter nowadays of just saying we will pay for everything, and there has become a more universal agreement that the way forward will involve a system of cooperation between government on one hand and the individual on another. But in pursuing some of the key principles of making sure that social care is free too, we put forward proposals, first of all, to make non-residential care free. We think it's the right thing to do. We think that currently it's affordable, though of course will become more challenging in time. We had proposals, for example, to then target specific elements of the older people community, starting certainly with those with dementia care needs, that we believe should be, the burden should be carried by government. But this is something that will take all parties working together to find solutions on. Not least because the answers, when they come, when they develop, are likely to happen across the lives of several governments. And short-termism really isn't something that we should be pursuing. We should be pursuing something that is sustainable in the long term. There have been developments on a UK level. The Dilnot report, for example, made some useful suggestions, but we must pursue the principles as far as possible and adhere to those whilst reflecting the fact that the individual will have to bear a part of the responsibility as we move forward.
So you're saying that non-residential, by that you mean support in a person's own home?
Yes, and that's something that we put forward specifically in our manifesto this year. We think it is deliverable, that it's affordable. Also, widening that to people with dementia needs in particular as well. Okay. But being realistic as to the growth of the older population in years to come too.
Which is to be celebrated.
Of course.
Okay. Can I turn to Councillor Elizabeth Evans, because you're actually at the sharp end in terms of service delivery, representing the county council perspective.
That's right. Social care, and I have sympathy with what Reen is saying regarding, at the moment, there's a tension between health and social care, and unfortunately, it's the individual that suffers because of that in many instances. How do we fund it going forward? Well, that is the question. The only thing I know at the moment is that families are having to behave as accountants. There are so many different areas of care: residential, nursing, extra care, continuing care. It is so complex, and it really is. And that's what we have to get our head around. With regards to home care, I believe there is a cap in place at the moment. But with regards to the review, and I believe that it is under review, and my notes tell me that there will be a conclusion in 2020. There's been a postponement. Now, the problem is that local authorities in Ceredigion, where I come from, we're already halfway into the year, we were over £1.5 million overspent because it is so unaffordable for us. The assessment, the Social Services and Wellbeing Act, obviously there's more onus, rightly so, on local authorities to make sure that they assess correctly and at appropriate times. The unfortunate thing that I see as a councillor is that they're raising the bar for assessment. So what we're seeing now for individuals that do need to cross the threshold into a residential home, unfortunately, to put it crudely, they're half dead before they even get in there. Now that's not acceptable, because there are people that cannot have home care. There are people that are isolated in their own homes and that need that social interaction within a residential care setting. Now, what I would say regarding funding, I've always been a supporter of free prescriptions. I always have been. I thought it was progressive as a policy. Now I'm starting to think, actually, this needs to be reviewed, because if we're spending 500 odd million on it, then I think it certainly needs to be reviewed. I should be paying for my prescriptions. There are people that are obviously residents who are protected by prescriptions anyway, so I think that certainly needs to be reviewed, because in an ageing population, if we are to pay for it, and I understand as well the Dilnot review is looking to raise the cap. At the moment, the cap is unacceptably low for people, and it creates tensions within families. So we need to look at it. We need to know how we can afford to pay for it. But this, at the moment, families having to become accountants rather than dealing with the care of their vulnerable family members, then we need to look at it as a government, and possibly through free prescriptions.
So what would the Lib Dem view be of the way to proceed on funding long-term care? Contribution might come from prescriptions, but how then do you...
At the moment, the Welsh Liberal Democrats support the continuation of free prescriptions. It is my view, and I don't speak for the party on this one issue. I think it's something that we're going to have to look at to review going forward. With regards to health and social care, it was in Plaid Cymru's manifesto, I know, that they should be as one. I actually have sympathy with that view, I do, because when we look at the discharge into our communities from hospitals, there's that tension again. Who's going to fund what? You know, I had a resident in Bronglais Hospital for 34 weeks because they couldn't get a home care package for him. Now, he was ready to go home, but they were arguing about funding and placements. That's not acceptable. What is the answer? What was in our manifesto? It wasn't the integration of health and social care, but I think it's certainly something that we have to look at going forward.
Okay, thank you.
Diolch. I think this is one of the critical issues facing not just this country, but as Rina said, actually the whole of the world at the moment. As we are progressing economically, people are living older, and that's to be welcomed. It's a great thing, but we can't ignore the fact that a child born today will live until they're about 100 on average. So, whatever the problem is today, it's going to be a crisis tomorrow unless we act. And we are, I think, staring down the barrel of a gun, and I think we need to act fairly soon. And I also agree with the idea that this has got to be a cross-party approach. This is something that we need, I think, a really comprehensive conversation with the people of Wales, because, frankly, England has ducked this issue. DILNOT has come out with recommendations. They have not had the guts to make the move. If they're not going to make the move, I don't think we can wait. I think we're going to have to act. And I think we have to have that conversation with the public in the next couple of years. I think that's critical. I've initiated a debate in the Senedd tomorrow on this very issue and written a quite comprehensive article that I hope you'll be able to see on the Institute of Welsh Affairs website tomorrow. Really looking at some of the very, very difficult issues, and I hope being provocative and asking some difficult and searching questions. Just remember at the moment that however difficult it is in Wales, it's more difficult in England. We do have this cap on home care, £60 a week, that doesn't exist in England. I think if you look at the fact now that we are starting this process of integrating health and social care, which is critical, because we are having these delayed transfers of care, and that is causing a problem not for older people, but for everybody else in the system as well. So this is something that crosses the generations, and that's why I think we need that comprehensive debate. I think we have to have a conversation about how we fund this. I don't think there's enough money in the pot. I do think it's about partnerships between the state and the individual. But what we have to have is that conversation of where that balance should be. And that's a difficult conversation, because you have to make sure that people are incentivized to save at the same time as protecting those who are most vulnerable who can't save. And that's, I think, something that we need to be looking at in future.
Okay, June, you put a challenging question. What appears to have emerged is the need for a commitment for an all-party approach.
Yes, I'm seriously disappointed. We all agree with the principles. We all know how important things like integration and so on is. I've been trying to make notes of what have people actually suggested about what they do, and the nearest we've got is have a conversation. That is seriously disappointing. What I was hoping to hear was the views of the different party on some of the options that there are, e.g. we could put tuppence on income tax, we could have a social insurance scheme, we could expect, and this was implied, individuals to pay more. All of them. But we have been having conversations. I was first involved in those conversations way back in 1990 on the Government's Clinical Standards Advisory Group. I was a member of the Royal Commission on the Funding of Long-Term Care in 1999. And I am bound to say, how long, oh Lord, how long before you actually do something about it? Because I'm 75 now and I need to know.
Thanks, June. And I'm sure that the panel members would welcome further thoughts you may have that perhaps they can introduce to the all-party discussions that need to take place.
Yeah. I mean, just in response to that, I understand that frustration, and you're absolutely right in saying that there are other ways in which we could bring more money in. In fact, Eluned raised in the Assembly Chamber, was it last week, that we have to look at how realistic it is to continue to pursue a low tax regime when actually we need more money coming in. The problem arises when it's not just care of the elderly that could tap into that extra 2 pence on your income tax or another form of taxation or another form of national insurance. There are pressures from all parts of the public services, and that's part of the issue that we face. But realising that there are some specific issues that are more important to some parts of our society, what we need to persuade is that it's not just a question for older people, how we look after older people, but it's a question for everybody.
Okay, Ian, do you have
I think from H Cymru's point of view, a lot of what I've heard of the panel, I actually would agree with. I think that, first of all, this is one of the biggest crises facing not just Wales, but the whole of the world, certainly Western Europe. Dilnot has failed in England. I was part of that work with Andrew Dilnot when I was in a previous job. And quite frankly, there's been a lot of intransience across the border. I think that the Welsh Government has an opportunity to do something a little bit more brave, and I think some of June's points there might warrant further investigation for the Welsh Government, particularly as we get a rolling agenda of devolution. So I think decisions might be easier to take on these matters in the future. I think there are some practical things we could do, and it was interesting hearing, well, all the panellists, but particularly from the front end. Because we don't, quite frankly, put enough money into domiciliary or home care, and I think we need to have better quality home care. We need to be able to pay agencies proper amounts of money so we can get well qualified and good staff in, and home care can keep people out of residential care further down, so there can be a saving, and that's something I think we need to do some work on to demonstrate. And I think as far as the issue of delayed transfer of care is concerned, detox, there's also a good case for better investment in intermediate care. That is making sure that there are teams of people that can help people come out of hospital and rehouse them back into appropriate environments. The final point I'd make, and I've listened to the integration argument between health and social care now for all the time I've been working in the third sector, which is some time, and it's still not happened. And it's promise after promise after promise for doing it, but it's never done. And the opportunity's there, so let's get on and do it.
Okay, thank you. We've spent a little bit longer on that first question because it's a critical issue, as has been identified by members of the panel. We move on now. Is Shirley Dodd-Clark here? No, she's not. Okay. Her question then is, why are women who are 70 years plus not invited to attend for routine mammograms when the incidence of breast cancer is higher in this age bracket than in any other? So there's a concern about age discrimination, and the question being asked is why?
Yes, at the moment it's from between 50 and 70 that I've just turned that corner, so I've had my mammogram, my first mammogram. The cut-off point is 70, but the point is there is no upper age limit for cancer. And the experts tell us that there is no evidence to suggest that screening after the age of 70 reduces mortality rates for breast cancer patients. I would argue that, knowing some of my mother's friends who have self-referred, because that's the policy the Welsh Government had, and that's a good thing in as much as they don't have it in England. We have it in Wales, where if you're over 70, you are able to self-refer. But very often that depends on a family member, like myself, telling my mother, Mum, the van is in the car park in Regent Street. You need to ring them, my mother is 84, to go and have your mammogram. Her friend did that, same age, 84. They picked up cancer. She's had her chemotherapy, and now she is in remission. So it does work. And as I say, there's no upper age limit. I welcome the fact that the Welsh Government say that you can self-refer, but actually I think they should just have that card the same as everybody else, the same as I did when I turned 50 to have a mammogram.
Well, yeah, I think it is important that they're self-referred. I wasn't aware that actually that the rate of cancer, breast cancer over 70 was higher. So I think that probably is an area that needs to be looked into.
It's not so much that it's higher, it's just that there are still instances of people having, it doesn't stop once
Yes.
you're 70, it does not stop.
Yeah. I think what we need to do is to, first of all, the fact that we have this screening process is critical. The fact that people can self-refer, it's critical that people take up that opportunity. But I think probably it's all about balance of how much cost against savings, and which is why I was interested to hear if you think it's a higher rate. I'm very surprised they would have stopped it.
Yeah,
So-
they're saying that what the experts say is there is actually no evidence to suggest that that death, mortality from breast cancer actually helps with screening after 70. Well, I'm not sure the evidence is there. In England, they're doing a trial at the moment regarding this, on the figures. But from my residents, I know who go to that wonderful van that comes around, which, you know, and the people do queue. But at least we have the option of self-referral. But it's an ageing population as well, obviously, over 70. There is no cut-off point for cancer.
So what we're being told then is that there's a challenge to there being a clinical justification, which leads one to assume that it's a resource-driven stance. Is that the? I don't want to put words in anyone's mouth, but
I mean, let's not pretend that all medicine is not in some way resource-driven. So, you know, for every decision that's made in medicine, it's got to be balanced off against replacing a hip for someone or whatever. So, you know, that's why we have this nice clinical accidents, really balancing off those decisions. And my assumption is that is the reason why there's a cut-off point and you're not invited after 70. I'm interested in pursuing that to see if that is indeed the case. At the moment, I think there is a reason for them not being invited. Presumably, that's balancing off against the cost of calling people.
okay, thank you. Okay.
My instinct, quite simply, is that we're very proud of the breast screening system that we have in Wales, and that it should be able to include everybody, regardless of their age. That would be my instinct. However, in reality, I would take the stance that we have to make decisions based on evidence. I'm not a doctor. You might have spotted. I'm not a doctor. There are people who are experts in this field, and they make decisions and recommendations based on evidence, and we should be pursuing this evidence. It's a hugely controversial issue, actually. I was quite taken aback. I'll share this story with you. This is not something that I subscribe to. I had a female clinician in my office last week who challenged me just on the way out of the door. We weren't talking about this. We were talking about other health issues. And she said, here's one for you. Here's one for you if you're up for a bit of a controversial one, but that would be good for the health of the nation. Scrap breast screening altogether. Goodness me. Her opinion was that it's just not working at all. There have been examples in Japan recently of a badly designed screening program that actually ended up costing more lives than it saved because of false negatives and the way it was delivered. Now, I'm not advocating that position at all, but it's a measure of the controversy of the issue that we're talking about. But as I say, my instinct is should be open to all, and clearly, my wife's grandmother had breast cancer into her 90s and didn't require treatment. She died with the cancer rather than dying of it. But if it can help people, we should be doing everything based on what's best through evidence to help.
Okay. Ian, is there a view from Age
Just
Cymru?
a very quick view, really. I think we would want to look at the evidence for why screening doesn't continue, in that kind of structured way post-50 and into the 60s and the 70s. And I think that as a charity, Age Cymru would want to see whether there was any element of, institutional discrimination against older women that go for that don't go for screening. But I think we would have to look at the evidence base first, and I think that's the kind of question that we as a charity would want to talk to older people across Wales about.
Okay, I think what the question has thrown up is perhaps the need for further scrutiny of the evidence.
Yep,
Okay.
absolutely.
So thank you for that. Is Sue Shannon-Jones here, please? Sue.
My question is, many older people live in areas that are very poorly served by public transport, not just rural areas either. Often they have to stop driving due to health problems. With hospital services being centralised, makes attending an outpatient appointment or visiting a relative a stressful, day-long outing. What can be done about this?
Okay, thank you. Hi, Lynn, do you want to say?
Yeah, I represent a rural area now, and I've got to tell you, and I'm probably going away from the Labour brief here, but I'm going to speak because I believe in it. You know, I had an auntie recently who was diagnosed with cancer. She didn't have any public transport. She had to travel for an hour and a half to get her radiotherapy treatment and had no transport. Now, thankfully, there was a volunteer system, which was absolutely incredible to help out. I think if we are getting to a point where we are saying, for the sake of clinical excellence, that we are going to centralise services, we then have a duty to ensure that people can get there. And I think, actually, this is an area that the Welsh Government needs to look at. It is not acceptable, particularly for old people, to be, you know, and younger people as well. If you've got, you know, children who get sick in the middle of the night and they're a long way from home, they've got to take their 3 children with them, and they're stuck in a hospital miles from home at 9 o'clock at night, accident and emergency, it is not acceptable. I think this is something that seriously needs to be looked at. It's an issue that I will be taking up on behalf of my constituents.
So how do you reconcile that with the trend in public transport is one of curtailing of services? And that's largely, if local authorities would say, it's because of reduction in the grant. But how would you reconcile that?
Look, where public transport exists, let's not forget that older people are allowed free public transport in Wales, which is something that doesn't happen in England. I think that's something that people should be happy with. So my concern is with out of hours times. That's my big concern, is abandoning people in hospitals a long way from home, out of hours when that public transport is not available.
Okay. Flynn?
First of all, transport needs to actually be considered when we look at how we plan our health services. And I fear that all too often it's just not put on the agenda when important decisions are made about what kind of health services we deliver and where. So 2 things, I think. One, you need to make sure that we have a health service that is appropriate to the levels of rurality and distances involved in needing to travel for healthcare. Of course, we need to pursue excellence, and that does inevitably sometimes mean that the treatment you might need is not in the hospital closest to you, but there should be a principle in the way that government delivers healthcare, that you are able to receive most of the healthcare that you need in a hospital close to you. So, transport and distances travelled should be a key factor when government comes to decide on the model of healthcare delivery. And secondly, you have to make sure that you then bring together the various parties, giving consideration to the transport provision locally, what needs to improve. There are steps afoot. I know Lyned's party and mine agree on the principle of regulating buses, and that is something that I hope to see happening in future, which would give government, local authorities more of a say on the shape of public transport within their areas. That's a key element that's missing currently from public transport planning in Wales. That element of control over where our public transport systems run to and from. But on top of that, of course, you have parts of Wales where you're never going to have adequate transport services. Where I live, I'm only a mile away from one of Wales's main roads, the A55. But if I was older, unable to travel too easily from one place to the other, getting to a bus stop a mile away would be a major, major challenge. So we also have to look at innovative ways of delivering public transport. There's one way that's been tested in West Wales, the Bookabus system, which works okay, but you know what, it is incredibly expensive. And I think there are more innovative ways. I was talking to one company based in Carnarvon a couple of weeks ago, actually, who've got a new set of proposals that basically tailors a bus's journey to your needs, but without the kind of costly element of Bookabus. So innovation, I think, is going to be key as well.
Right, Elizabeth.
There is currently a disconnect between local authorities, the health board and the patient seems to be at the back of the queue. We found this recently in Aberystwyth in Ceredigion, where the local authority has withdrawn the subsidy for the park and ride, which took them the outpatients and the patients and the visitors, right to the doorstep of Bronglais Hospital, and now it's a tortuous route to get there. When you dial 999 and you call for an ambulance, you don't know what hospital that ambulance will take you to. In Ceredigion, it could be Bronglais, so we could go cross the border into Carmarthenshire and go down to Glangwili. We have had patients discharged at 1 o'clock in the morning having to pay for a taxi to get home. There was one well-documented incident where this old man was found walking along the road at 1 o'clock in the morning because he didn't know what to do. Now, that's obviously unacceptable. What we've also found, it goes back to the centralisation that Eluned was talking about, centralisation of services, but also centralisation of appointment systems. And that means that we were having patients in Ceredigion needing to go for a scan in Carmarthenshire, and their appointment was at 8 o'clock in the morning with no way at all of getting there. So you can understand the issue straight away. So we have that disconnect. There needs to be, along with the patient notes, there needs to be a story regarding the bus, because with Bookabus, for instance, you can and it's been a lifeline for many rural areas where they've had their bus services cut. You can book it 24 hours in advance, but that's not always useful because of the appointment systems. So the patient needs to come first, without a doubt, and there needs to be something on the notes regarding their ability to be able to get to hospital, because not everybody qualifies for patient hospital transport, whether it be country cars or the Welsh Ambulance Service. Not everyone qualifies for that, and there's a great many people that fall outside that bracket.
Okay. Wearing a different hat, I chaired a number of public consultation meetings in North Wales on the NHS proposals for centralising services. The independent chair, by the way. So, certainly, whilst there was a strong clinical case being made, what was often absent from each of them was the transport implications for patients. So you can't do anything in the public sector without an equality impact assessment. And perhaps local transport needs need to feature high on that list of equality impact. And perhaps that's something we can take away. Yeah?
Well, the Age Cymru vision is for an age-friendly Wales, and a proper network of community-based transport is obviously essential to achieving that, because we've seen incidences, and Ceredigon's a good example, where even profitable bus routes have been closed down for no good reason. So I sometimes think the charity does often ponder these questions. I think more investment in community transport might help. There's certainly an untapped resource out there in many cases. I think the issue about transporting people to hospital is slightly broader than that as well, because I can remember I just started this job, so it's around about 3 years ago, when there was the closing down of day centres in Rhondda and Taff, and the closure of bus routes at the same time, which meant that people who couldn't go to the day centres that were shut couldn't catch buses to the other ones, and therefore it increases loneliness and isolation. So I think there needs to be a better, more integrated approach. We very much feel that the transport system in Wales is fragmented, irrespective of where you go. So I think it needs probably a better transport policy, which needs to come from government. We welcome the free public transport for older people, and we know there's a high take-up of that in certain parts of Wales. I think that needs to be better encouraged as well. So I think there's a loneliness and isolation issue there. But I think more investment in community transport and looking at what we've already got and bringing it back into a single plan and a single vision for transport in Wales. We promised the new metro here in South Wales, but that's South Wales, you know. I mean, Ceredigion, Gwynedd Mon, those areas, they need investment too.
Okay, certainly what I'm left with, and hopefully other people here too, is the importance of the out-of-hours transport, the travel to hospital and the travel home from hospital. So if panel members can actually take that back to their respective parties and gatherings to try and persuade the Welsh Government to take that very seriously. Steve Barclay from Older People's Commission.
Good morning. Given that legislation is a non-devolved issue, given the scale of the reported neglect and ill-treatment of older people in care homes and hospitals, and in particular those older people with dementia, do you consider the existing legislation is fit for purpose, especially when there are very few prosecutions against those professionals who are responsible for the provision of care?
Okay, just to clarify, you're saying that the Welsh Government or Welsh Assembly should be looking to have more of this devolved, or?
A bit of both, really. Looking to devolvement, but also about bringing pressure or guidance towards UK government to drive this agenda forward, because it's something that certainly we've identified across Wales where there's been reported instances of neglect, ill treatment, as I say, across hospitals and in care homes on quite a large scale.
Okay.
Number of elements, perhaps. There's the non-legislative route, professionalisation of the workforce. A lot of that going on already, though rather overdue, I think, from Welsh Government. On legislation, you might be talking about elements of criminal law here. I'm a big supporter of creating a full Welsh jurisdiction that would involve criminal law too. It will happen in time, it just can't happen quickly enough, unfortunately. You have a current situation where a doctor or a nurse can be struck off, but a manager of a nursing home can't. And obviously that's something that legislation would be required to do, presumably. But also in criminal law, clearly criminal law, we have to see more prosecutions, and manslaughter when it happens should be, when it's clearly manslaughter in the eyes of the public, should be treated as such. So I think there are many elements, some of which we can do here in Wales now, some of which I believe should be able to do in future. But we have so many well-documented cases that we can't continue to ignore, I think, the need to take some positive steps.
So can I just clarify, because there is a level, fitness to practice level, which is dealt with within Wales, isn't it?
There is, yes.
Yes.
But in terms of accountability, when things go badly wrong...
Beyond that?
Beyond that,
okay.
Yes, that's quite a significant issue.
Okay, thanks.
Well, I think, first of all, we should get some perspective on this and make sure that we're not scaring people. The vast majority of homes are well run, and actually we've got to remember that people are fearful if we hype this up too much of putting their parents into homes that are good. So let's make sure that we're absolutely clear that we are not talking about all homes here, and these are absolute exceptions of when things go badly wrong. I visited a couple of homes last week, and one of the issues that the care homes, and they're under extreme pressure for all kinds of reasons, financial pressure as much as anything else. One of the pressures they're under is actually the regulatory issues. And one of the things that was interesting to me was to hear how a lot of their time was being taken up by different inspections. So you had the care homes inspection itself, which is a kind of an independent body. Then you had the Social Services Inspectorate, and then you had NHS Inspectorate. And they're more or less asking the same questions. Now, really, do we need three different... I think that's an example of where we could be cutting down, streamlining things, saving those care homes a lot of time and effort, but let's make sure it's really detailed and comprehensive. I think we've got to make sure that we build on this Social Care Act and the Social Services and Wellbeing Act that's been introduced by the Assembly. That has strengthened, I think, the ability to inspect these homes, and I think that's a good thing.
As Elaine had said, there are many excellent care and nursing homes, nursing environments, and there are. But then there are those few that do come to our attention, whether it be through the media. When I was chair of audit in Ceredigion, I used to see all the regulatory reports, and I have to say I've read some into a residential home that were damning, yet I never saw an arrest. I do think that CCSW need more teeth. What I would also say is that it's a changing time for local authorities because we're commissioning more. So as we see residential homes privatised, that we're selling off our own, then we're turning into commissioners. So there is a commissioning role there, and that has to be scrutinised. So there's that tension again through a CCSW inspection, an NHS inspection, and of course local authority making sure that they get value for money, but also that the residents that we put in the residential homes actually get the care and attention that meets the standard. What I would also say is a generalisation regarding the environment. It's incredible, isn't it, that you look at nurses and it's a vocation. It's paid accordingly, although nurses would say not. But when you're looking at the care home environment, the turnover of staff is huge. And the training also is not there. And that comes to homes that care for people with dementia, early onset of Alzheimer's, where the training sometimes is not up to scratch, and either that home quickly withdraws from taking those patients, or unfortunately, there are accidents. And we've got one home where it's not unusual, or wasn't before they stopped taking patients, that they would call the police because their staff just didn't know how to deal with the patient because they weren't trained properly. And it's all about training, and it's all about proper levels of staffing, and not cutting corners, but proper legal levels of staffing.
Can I just throw in a supplementary? Have our regulatory bodies become too focused on process and losing sight of outcomes?
Yeah, it's a good question. We always get that in Welsh Audit Office briefings. Yeah, you must always look at the outcome, and obviously the process is important, but the outcome in this case, for the patient, is above all important. Okay, Ian?
I think the direct answer, without wanting to be too reductionist, the direct answer to your question is yes, we should do more to prosecute. And I think we've got enough good examples, unfortunately, here in Wales to demonstrate that. I mean, the Commissioner's own review of care homes from last year, I think, shows where, even though there are good homes there, it shows where homes are failing, both residential and in nursing areas. But I think I'd like to focus on some of the lessons that we learnt from Operation Jasmine and Justice for Jasmine. I worked with Margaret Flynn on that particular thing, and I got to say it was the most harrowing thing I've done in 20 years in the sector, working with the families of people, of those who were abused and who died in care, and there were no prosecutions at the end of it, and it cost the Welsh taxpayer, the British taxpayer arguably, millions of pounds. Gwent Police are still sitting on the files. In credit to the First Minister, he did the review. It was all but the public review, but and I think that was a good and a positive thing, and I think it sent a message. But I think we've got to be a lot more savvy about prosecutions, because it's not just about criminal investigation, it's about health and safety investigation. And I think Operation Jasmine and Justice for Jasmine showed that. So I think, yes, we have got to be bolder in making those prosecutions, but we haven't necessarily always got to be looking down the straightforward criminal route. And the final thing I'd say, and we back this idea of integration. sitting on as an advisor for the Health Inspectorate Wales, I'm a big fan of actually integrating the inspectorates, because at the moment we are duplicating in some areas, and also we're spending time, the Health Inspectorate Wales is spending too much time looking at the regulation in tanning parlours rather than on hospital wards, and I think that's a real letdown.
Okay. We shouldn't forget, of course, that we should get a degree of reassurance from the statutory powers that exist in your office, Steve. Yeah, okay, thank you. And also, in terms of providing balance, I'm very happy to celebrate the superb quality of residential care my mother enjoyed the last 2 years of her life in Carnarvon. So there are some excellent examples. So thank you.
And I'm glad that Lynette started shopping around already and visiting a number of...
Okay.
I got a few recommendations if you're interested.
Thank you. Arthur Davis, Michael Hutchinson. Is this a joint effort? Here we are. Thank you.
I would like to know if the words convalescent home have been completely forgotten. Could this be a way of beating bed blocking that the elderly are so unfairly accused? There are plenty of disused NHS buildings, I'm sure, that could be used, or parts of NHS buildings that could be used for these convalescent homes.
So people don't need to convalesce anymore, then, is it? Yeah, that's the implicit. Yep.
Yeah.
Yeah.
It gets them out of the place that's offering full care into somewhere that doesn't need to offer such expensive care.
Yeah, thank you. Elizabeth?
I used to have a cottage hospital in Aberyron where people used to come off the hospital ward and they used to enter the cottage hospital environment to recuperate and to make sure that they're rehabilitated to go into their own homes. Sadly, that's not the case now. The argument that we are given is that there is plenty of physiotherapy and rehabilitation that can take place in your own home. I would argue against that because some people hit the hospital ward, they may have had a broken hip or a knee replacement, and they are simply not ready to return to their own homes. What happens? They return home and they are readmitted. Now, if you went back and looked at your own health boards, I can guarantee that on a bank holiday Friday, the level of discharge of elderly people is so high that by the Saturday or the Sunday, they are readmitted via the ambulance service because they're discharged too soon. So, in answer briefly to your question, yes, there is certainly a place for convalescent homes, or they're doing it in London. One of London's biggest hospitals, Northwick Park, have a building on their property. It was an old part of the hospital that they've renovated, and it is now somewhere. The bed blocking, and I hate the word bed blocking, but it is a fact. There are people that do not need to be in hospital beds, but they're not ready to go home. They go to this centre. My mother's sister has happened to her. They go to the centre. She has a rehabilitation. She can go home safely, and she's been there ever since without being readmitted.
Okay,
I mean, first of all, you know, there are many NHS previous hospitals that theoretically could be used, but a lot of them are just not fit for purpose. You know, they might have asbestos in them, or you know, they're just not up to the standards that people would expect today. So I think we need to consider that. Look, are we going to start building new builds for this? Look, there are economic problems with that, so I think we've got to look at who owns homes these days. I have some ideas around this about what we should be doing as a nation. I think if you look at nursing homes, for example, I think that model, nursing home model, is not sustainable in the long term. It's not financially viable. You can see lots of care homes pulling out of nursing home care. They can't recruit nurses. At some point, though, the state's going to have to step in. We're going to have to pick up. We cannot leave older people in a terrible state. The state must step in. We have a responsibility. So rather than waiting for it all to collapse, let's plan ahead. We come back to this issue that we started with right at the beginning. I've been siarad yn Gymraeg, achos Steffan di gweud dim byd eto. Na I just siarad tyma bach yn Gymraeg, fel bod Steffan yn cael gwaith I wneud. dwi yn meddwl bod e'n bwysig yn bod ni yn meddwl o ddifri am sut ni'n mynd i ariannu care homes y dyfodol a nursing homes y dyfodol. Mae yna broblem os ydych chi'n edrych ar faint o bobl fydd yn dros 85, pan y fi yn 85, bydd 180,000 o bobl dros 85 pan fydda i a rhin. Mae hwnna'n loads, mae hwnna'n bron Abertawe i gyd dros 85 mlwydd oed. Does dim strwythyr gyda ni i ddelio gyda hynny ar hyn o bryd. Mae'n rhaid i ni ddatblygu strwythyr newydd, mae'n rhaid i ni ddechrau trafod sut i ni'n mynd i ariannu hynny, a dwi'n gwybod bod pobl yn colli amynedd gyda trafod, ond dwi yn meddwl bod ni wedi dod i crisis point. Dyn ni ddim yna eto, ond ni yn mynd i ddod at y fecyn bo hir, a mae rhaid i ni wneud penderfyniadau, dwi'n meddwl yn ystod y 2 flynedd nesaf.
Dwi'n gytuno efo chi 100%. Dwi'n meddwl bod ystyr convalescence wedi newid eitha lot dros y blynyddoedd. O'n i'n siarad efo fy mam yng Nghyfraith yr wythnos diwetha, oedd yn atgoffa fi i bod hi wedi cael 10 diwrnod o convalescence ar ôl rhoi genedigaeth i'n Ngwraig i nôl yn 1972. Ie, jyst rhywun yn bwydo un yn os a newid i ffloti mwyn iddi gael gorffwys ag ati. Felly dwi'n meddwl bod disgwyliadau pobl wedi newid sbel ers hynny. Ond dwi'n gredwr cry iawn bod gyda ni step, os nad argoll, ond yn prysur ddiflannu o'n system iechyd ni. Sef yr gofal yna wedi arwain gan nyrsys i'r person sydd wedi cael triniaeth o bosib, ond sydd ddim cweit eto yn barod i fynd gartre. Mae gen i ysbyty yn etholaeth i, ysbyty Penrose Stanley yng Nghaergybi. Adeiladwyd yn yr 90au, felly mae'n ysbyty eitha newydd, ysbyty tair ward. Mae un o'r wardiau yna heb gael ei hagor erioed bron. Mae hi'n cael ei defnyddio fel stordi. Mae yna adnodd yn y fan yna ddyle fod yn helpu pobl i ddod dros driniaethau, ond yn ail hefyd tynnu'r pwysau oddi ar yr ysbyty cyffredinol y Mangor, lle mae gwlau yn cael ei blocio. Mae'n chwaer un llawfeddig orthopedic ar gyrion Caerdydd. Ers cael ysbyty Dewi Sant ym Mhontypridd, mae hi rwan yn gorfod canslo triniaethau yn rheolaidd oherwydd bod na ddim gwlau i bobl fynd ar y cam nesaf na ar ôl gadael yr ysbyty ar ôl iddi hiw trin nhw. Oni bain bod ni'n ofalus, da ni yn creu problem fawr un hunain ar gyfer y dyfodol. Ac os ydym ni'n gwybod mae heneiddio mae pobl, a bod pobl o bosib wrth fynd yn hun angen chydig yn rhagor o amser i ddod dros triniaeth, wel siawns y dyla ni fod yn paratoi ar gyfer hynny a sicrhau bod y gwlau yna ar gael yn cymunedau ni ar gyfer pobl sy'n hangen nhw mwyn gwella o driniaeth.
Y cwestiwn wedyn ydy pwy fydd yn ariannu hwnnw? Llywodraeth?
Mae hwn i fi yn rhan o'r drefn NHS. A fel dwedodd Elizabeth, mae'n enghreifftiau yn digwydd yn barod o fewn cyfundrefn ysbyty, lle mae ychydig o wlau rhatach o lawer i'w rhedeg, wrth gwrs, na gwely ar brif ward ysbyty, yno ar gael mwyn arbed arian i lawr y lein. Mae'r mater, fel dwedodd Elizabeth eto, o bobl yn cael ei gadael adre o'r ysbyty yn rhy gynnar ac felly'n cael ei ail dderbyn mewn i ysbyty, mae hynny'n costio arian. Felly, defnyddiwch rannau a datblygwch rannau'r NHS sy'n rhatach yn yr byr dymor i'w rhedeg, ond sy'n mynd i arbed arian yn yr hir dymor.
A chos iechyd hefyd, ie.
Dwi'n gwahaniaethu rhwng fan hyn. Nid sôn am gartre gofal, nid sôn am gartre nyrsio ydw i. Dwi'n sôn am ward gwella.
Ian,
okay. I'm going to give a very South Walian perspective on this. And first of all, I grew up in the South Wales valleys, and my dad was a miner, not surprisingly. And, he contracted chronic bronchitis, emphysema, mining diseases, which eventually killed him. But my childhood was punctuated by my dad going into a convalescent home from the community, because basically he was very difficult to deal with because those diseases brought depression. He attempted suicide on a number of occasions, and he went to places like Talagan, which is long gone now, And he came out looking like a different person. So my personal experience of somebody going from the community into convalescence and then back to the community is very positive. Yeah. And I've grown up with that. And I grew up in a community where that was very expected. Yeah, that was expected because of the industrial nature of the community in which I was born. I think things have changed. I think some of the points made by some of the panel members around some of the other things we need to do now. We talked earlier on about delayed transfer to care, detox. I spoke about intermediate care and better intermediate care. I think we can do things in hospital wards where people can convalesce in hospital, but I don't think that's the full solution. I think the communities need investment. I think there are, perhaps as one, I think it was Reen said, wards within hospitals for convalescence could work again. I think it would take a little bit of expansion of some of the functions of hospitals, and it would mean having to spread that throughout different communities across Wales. The centralisation programme is working against this, so we need, as I said earlier, better community-style care as well, through domiciliary care, and perhaps better respite for people who have to look after people who need convalescence. So it's not an ideal answer. It's very personalised, but it just needs money and it needs better resource within hospital environments.
Thanks. Two Assembly members have got committees that they're expected to be attending imminently. I'm going to see if I can negotiate on your behalf. Can you give another 5?
I give 5 minutes.
5 minutes?
Yeah.
Okay. Thank you.
Negotiation.
Well, it would have been, it wouldn't have looked good saying no.
Right, is Gareth John here? No? Okay, this is a question about many people over 60 have benefited in recent years from being able to use the swimming pools at leisure centres free of charge, certain times of the day. So what can be done to ensure free swimming for older people remains available? That's for your local authority colleagues?
I mean, briefly, that there's a financial implication to that, especially as we have more leisure centres hived off to the private sector, I think, where there would need to be a recouping of cost by those new delivery companies. But this is a real hobby horse of mine. I'm a huge advocate of physical activity as a preventative tool for good health, not just for the elderly, not just for older people, but right from a young age. This is something that we've got to get right. I'm pushing it as hard as I can through the health committee currently. There's got to be good practice out there. We need a culture change in our attitude towards physical activity. If we don't get this right, all our efforts to make our NHS sustainable are going to become either go to waste or become much, much harder at best.
Okay. I suspect that there won't be not awful lot of conflict of thought about that response. Can I give this one last question then, which I think is perhaps a bit more challenging? Some grandparents suffer contact denial with their grandchildren following the breakup of a relationship. What more can be done to support grandparents in this position to have access to their grandchildren?
Oh God, this is so tragic, isn't it? There's nothing more important for a grandparent than their ability to make a bond with their grandchildren, and of course, you know, we're seeing more and more breakups now, and life is becoming more difficult. Look, to what extent does the state get involved in a private matter is quite difficult, I think. But I think the state does need to get involved in a private matter if grandparents are being denied the opportunity in the same way as a father would be denied an opportunity or a mother is denied an opportunity. I think grandparents should have rights in the same way as a father or a mother has rights. But I can see somebody wants to come back in.
So, and forgive my cutting in there. Yeah.
We do have a right.
Yeah.
To make an application.
Yes.
An application to court, to family court, which would cost £215, where the judge could look at it and say, well, no, I'm not going to take this application forward. But I think what the panel need to know that most resident parents are mothers, and most of the grandparents that I'm a member of several groups because I'm denied contact with three of my grandchildren. You know, the non-resident parents are the fathers, and if the non-resident parent being the dad then often the whole of the family don't get to see their grandchildren. But I just really feel it's with the £250 application, and then it could be just thrown out. That is absolutely appalling when grandparents put so much into the development and helping the parents to be able to work.
Okay.
Yeah,
Quick
yeah.
response?
I've dealt with many cases regarding parental access. You have a right, as you say, it's a costly right, and unfortunately, as you say, it's the grandparents of the non-resident partner that's affected. I've done battle many times with family court judges over this issue because I don't feel that they are particularly sympathetic. But yes, the law is on your side in as much as that you have access. But it's a tortuous route and it's an expensive route, and you should be given... in fact, I didn't actually realise it cost that much money. Yeah.
And as I said, even if you knew that your case would be heard...
There's no guarantees there. And there should be.
There should be.
Yeah.
Case could be heard. But of course, then, if your son is denied contact, you know, would it be right that then you, as his mother... is able to see the children leave, isn't it?
No, that's right. Unless there's an extenuating circumstance, you should have absolute right. A grandparent should have right to see their grandchildren.
Final word now from
Yeah, it's very briefly. I don't know what can be done, but something needs to be done. I've dealt with an issue exactly like yours in my constituency. I tried to help to see if I could help smooth things out, try to point people in the right direction, but it wasn't sorted out, and I could really feel the pain of that grandfather who came to see me. So I don't know what the answer is, but something's got to be done.
Yeah.
That's an interesting concept, isn't it?
Yeah.
Okay. Jenny Sims, I'm sorry, we're out of time. I've negotiated 5 and we've gone to 6. Can I say thank you very much to the panel members for coming along. They've given over an hour of their time this morning, and they've answered honestly, not always given the answers we hoped for, but I'm sure they've gone away very much with the messages of the group of people here this morning ringing their ears. Diolch yn fawr iawn i chi gyd am eich amser bore yma.
Diolch yn fawr iawn. Thank you.
Thank you.
Diolch yn fawr iawn.
Diolch yn fawr iawn.
The system needs money. This is a rich country with lots of sources of money, whatever our problems. I challenge each of the political parties in Wales to say, where would they take the money from? And it's more than just a conversation.
Thank you, Jim.
Yeah.
All right.
Okay.
Definitely.
So eisiau rhoi i ffwrdd heddi?